Hello, ladies and gentlemen. This is Deb Uber. I am the Education Coordinator and Fertility Clinic Liaison for the Embryo Adoption Awareness Center. And today we are pleased to bring you the webinar titled Shipping Embryos for Donation, Removing the Burden from You to Us. This webinar will be presented by Ms. Alyssa Trammell. Alyssa is the Snowflakes Adoption Coordinator. She is also in charge of client services for the Snowflakes Embryo Adoption Program. She personally coordinates shipping information for the program, working with your clinic to make the shipping process simple. Alyssa has received her bachelor's from Biola University and came to work for Nightlight in 2013. She also draws up the legal contracts for transferring ownership of the donated embryos. So Alyssa, thank you for joining us today.
Of course. As Deb mentioned, my name is Alyssa Trammell. I've worked in the Snowflakes program for about 2 years now, helping coordinate between clinics. And today I'm just going to be sharing the part of the process that involves getting the embryos from the clinic where they were originally created to the clinic that will be receiving them, where the intended parents are working. As I mentioned, there's 2 clinics normally involved in the process. There's the clinic that originally created the embryos, which may be you if you're listening today. Your clients may have gone through your clinic for in vitro fertilization and now are left with remaining embryos, feeling that their family is complete and wondering, what are we going to do now? What's our next step with these embryos? Also, if you're listening today, your patients may be the intended parents who are hoping to receive donated embryos through our program. So today we're going to be outlining what that process looks like, both on the clinic that created the embryos and then also on the clinic's end who will be receiving the embryos. One of the biggest questions we get is, where are the embryos coming from? As I mentioned, all of the embryos that are being donated through our program are coming from clients who have gone through in vitro fertilization previously, have completed their family, and now have remaining embryos that they have no intention of using personally. So they are currently stored at whatever fertility clinic they chose to work with for their in vitro fertilization process and will remain there until they've been matched with a recipient family who will be receiving their embryos. At this point in time, we've had over 1,000 donors come through our program and donate their embryos through the Snowflakes program. We understand that if you're on the recipient end of the clinics, if you're the clinic that will be receiving the donated embryos, that you have various requirements. We also know that these requirements, while there are some generalizations across the board, your clinic may have specific requirements that we have to meet. From the get-go, when we start working with you, we will do our best to understand what these guidelines are and what your clinic requirements are. We've recently created a new form, if you are the clinic that will be receiving the embryos, for you to fill out, stating your specifications and your preferences for the donated embryos, just so everybody can be on the same page and know what you're looking for so we can better serve you with that. On top of that, we'll also work with your patient just to coordinate their desires along with your clinic preferences. We'll try to do our best to make sure their preferences are compatible with yours and make sure we can serve both the clinic and our client and just make everybody happy with the match and comfortable moving forward. Also, we will make sure that we communicate any known information that we have about the embryos that are being donated to you, the recipient clinic. That brings up the question of what information do we gather from our donor families before they're considered eligible to donate their embryos through our program. When a family decides to donate their embryos through the Snowflakes Embryo Donation Program, we contact their clinic that's currently storing the embryos. We will ask your clinic for embryology reports. We'll ask for the freeze and thaw protocol for the embryos. And we'll also ask that your patient fill out an FDA questionnaire if they have not already done so. This is just a risk assessment form that's compliant with FDA guidelines, just to make sure that there's no obvious reason that this couple shouldn't be considered eligible for embryo donation. We also ask that the couple complete a physical, which will also need to be signed off on by their doctor, stating again that there's no obvious reasons that should bar them from donating. We'll also have your clinic fill out an eligibility determination form, including a summary of records, so we can pass this information along to the clinic that will be receiving the embryos. Finally, we will ask for copies of the labs from both donors that were completed at the time the embryos were created. We understand that most couples, when they are creating embryos, are doing this for autologous use, and therefore the screening process may be somewhat less rigorous than the FDA requires for anonymously donated embryos. So with that in mind, that's why we send out the physical form, that's why we send out the FDA questionnaire to try and bridge that gap between what was originally done when the embryos were created and what the FDA requires in order for those embryos to be eligible for donation. We will connect with you and make sure that ahead of time we know everything that our genetic family may need to do in addition to the information that we have gathered to meet your clinic requirements, so you can make sure all your T's are crossed and all your I's are dotted. One of the most common requests is for additional blood work. As I mentioned earlier, most families, when they create the embryos for personal use, they will do some base level blood work at the time the embryos are created, but they may not have completed the full FDA required panel of blood work. In response to this, we work with an agency, Labs, that is compliant with FDA requirements and has their CLIA licensure information on every page of the results to complete this lab work for our genetic families that are donating their embryos. If your clinic requests additional blood work, we will send out the information to the donor family on how to complete this step. And then as soon as they have completed the blood work process, we will email those results directly to your clinic for your records. Additionally, aside from what is required of the family donating their embryos, we understand that your clinic may have requirements for the family that is receiving the embryos. One of the most common requirements we come into contact with is a psychological evaluation. While some clinics may have their own in-house program for this evaluation, we require every recipient family coming through our program to complete a home study. This involves meeting with a social worker at least 3 times over the process of a month or 2 to discuss their feelings about receiving donated embryos and raising children that are not biologically related to them. We will go through the ins and outs of what that looks like, how to explain that to their children, and also just making sure that the family has properly worked through the emotional implications of moving forward with this method of building their family. Additionally, we require them to undergo an FBI background check and also a few other levels just to make sure that they are in a good spot to be building their family in this way. We don't automatically send this out to every recipient clinic, but if your clinic does have a requirement that families receiving donated embryos undergo psychological evaluation, we can go ahead and send you a copy of this home study report upon your request. Aside from all this information that's getting passed back and forth between both the clinic storing the embryos and the clinic that will be receiving the embryos, the recipient family also gets some additional information. We ask the donor family to fill out a detailed and extensive medical history going back several generations, and we'll send that information along directly to the intended parents. The intended parents can review this information so they can be aware ahead of time of any medical concerns that may come up with any child they have from these embryos, and also just so they can make an educated decision on whether or not this genetic family is the best fit for them moving forward. Aside from the medical information, we also have our donor families complete a family profile. This is typically several pages long, includes photos, and outlines the donor family's infertility journey. It also addresses whether or not they had children from the same sibling set of embryos. That way, the intended parents can know if there are any genetic siblings out there, and they can have that awareness going into it. It will also talk a little bit about the family and their preferences for contact, and basically this is just the way that the adoptive family can get to know the donor family. If we send that out to the recipient family, and then we also send all this information to your clinic about the embryos that are being donated, once we receive explicit permission from both the intended parents saying they feel comfortable with the match, but also directly from your clinic saying, we've reviewed the records, we feel comfortable with this, yes, we can accept these embryos and still be FDA compliant. Once we receive that confirmation from you, we will go ahead and draw up the legal documents transferring the ownership of the embryos from the donor family over to the intended parents. This paperwork goes into parental rights. It makes sure it addresses issues of inheritance and basically just makes sure we have all of our bases covered as far as terminating all ownership and legal rights on the genetic family's part and transferring that over to the intended parents. We send out copies of those legal agreements to both the donor family and the intended parents and ask that they get that back to us within a few weeks. Once we receive the signature pages back, we can also go ahead and send a copy to either both the sending clinic and the recipient clinic, so you do have some form of written proof that the ownership has been legally transferred and you are in the clear to move forward with transporting these embryos from your facility into the recipient facility. Once more at this point, I will also contact the clinics to make sure one final time that everybody has everything they need to move forward with transporting the embryos. We let our families know ahead of time that most likely they will have to fill out paperwork with the clinic storing their embryos, giving the clinic consent to release their embryos. Also, we make sure the recipient family knows that they will most likely have to fill out paperwork with their clinic ahead of time too, giving their clinic consent to receive those embryos. I will touch base personally with both clinics, making sure that if you're the sending clinic, that you have gotten the necessary release forms from the donor family, and if you're the recipient clinic, making sure that you've gotten the necessary consent forms from the intended parents. Once I get the green light for both clinics, I will go ahead and gather the information, including the name, email, phone number of the person who I will be working with personally to set up the shipment. Typically, this is either a lab director or an embryologist at the clinic. I will also ask for an address where the embryos will be coming from, and also an address where the dry shipper containing the embryos will be sent to. And we'll be confirming this information to make sure there's not any oversight on that. Another common question that comes up is, okay, what if we get to the shipping portion, we're all set, we've got all the paperwork, but our clinic doesn't have a dry shipper? We have partnered with an organization for several years now that allows us to rent their dry shipper for the transport of embryos. So if this is an issue and neither clinic has a tank of their own that we can use for transport, that's fine. Just let me know during that coordination process, and I will take the necessary steps to coordinate the rental of one of those tanks for the transport. Once I've got all of your contact information, I know who I'll be working with, I will go ahead and start setting up a specific date and time with both clinics. This would be the time to let me know if there's specific days of the week where you would prefer to receive the embryos or you can't receive embryos, and also on the sending clinic's end, if there's a day of the week where you're able to send out the embryos, and if there's days of the week that don't work as well for you. So I can be aware of that when coordinating the dates. Once I have tentative shipment dates from both clinics, I will type up a shipping letter, which will include all of the contact information necessary for the transport of the embryos. It will include the sending clinic's contact person and information. It will include the donor family's full names for identification purposes. It will include the recipient clinic's contact information and the point person there, and will also include the intended parents' names. It will include the dates and the times of the shipment, and also my contact information as well, in case there's any problems with the information listed there. I will send out a copy of this letter via email to both the sending clinic and the recipient clinic to confirm that I've listed all information correctly and that the dates and times listed work for the clinic. Once this has been approved, we go ahead and move forward with the actual shipment on those dates listed. We understand that the clinic storing the embryos may have fees in place just to cover the coordination of the shipping process. Your client who is donating their embryos should not be billed for this, but rather Nightlight should be billed directly for this. We cover the handling charges, we cover the shipping charges. The donor family should not be paying any money out of pocket for this process. So when it comes time to ship, you can either call us on the shipping day, and I will personally provide you all of the correct billing information to charge Nightlight for this, or you can send us a bill and we will reimburse you as soon as we receive that bill. We ask that the sending clinic include the thawing information for the embryos that are being transported, and then also any other relevant documentation with the shipment. This includes information identifying the specimens as those listed and agreed to by both clinics, and also anything else relevant that may need to be sent with the shipment. Once the embryos have arrived safe and sound at the recipient clinic, we just ask that you go ahead and give us a call to confirm that everything went according to plan, just so I can keep both families updated on the process as well, to let them know that the shipment did happen. And for the intended parents, I can let them know their embryos have arrived. And for the donor family, I can let them know that the embryos have been transported out of their clinic at that point in time. That's just that's an overview of our process and what it looks like from start to finish as far as the clinic involvement goes. And that concludes my portion of this presentation. If you have any questions about any facets that were covered during this presentation, please feel free to contact our office directly. I would be more than happy to speak with you myself and answer anything else that may have come up as far as your questions go during this presentation. And now I'm going to give it back to Deb, who will be talking about some upcoming webinars that we are offering. Thank you.
Thank you, Alyssa. That was really great. Yes, I do want to share about 2 webinars that we actually present on a monthly basis. The first one is on February 18th. We will be presenting Embryo Adoption, Affordable and Accessible. And this is an evening webinar that is for families that are just looking into embryo adoption if they're interested, if they want to look at what does this process look like, how can we pursue it, are there pros or are there cons. They can ask really any questions and we'll answer them for them. And so that webinar we actually share on the 3rd week of every month. And then we also have embryo donation, choosing to donate for life. That's going to be on February 25th. And that one is actually also on the 4th week of every month that we present that one. And that is for families that are looking for, just looking into their disposition options. And they are looking into, okay, what can I do with these embryos? Maybe they're not comfortable with disposing them or discarding them. They want to look into something different. So this is something that they can hear, what we can do for them, the benefit of choosing embryo donation, and just see if this is an option that's good for them. So if you can't attend the webinars in February, we do have them on a monthly basis, and we just hope that you will come check out our website so that you can see what dates we have them upcoming. And we want to thank you for attending this webinar. We hope it was helpful, and just really appreciate you being able to come. Thank you so much.